Okay, so I'm going to get started. I'd like to welcome everybody to the Medical Marijuana Awareness webinar. This particular webinar is on PTS and PTSS, a subject that obviously is near and dear to a lot of people's hearts. It's something that's something that we are at this point in time dealing with, and we know a lot more about it today than we did years ago, but it's something that medical cannabis has helped, and it has contributed substantially to the quality of people's lives. So that's why we're going to do this. We've actually had a couple of these in the past of this particular webinar, and we're doing this because of the demand that we've had. Now, I do want to mention a couple of housekeeping things. First of all, this webinar is closed captioned. So if you're interested in closed captioning or seeing the closed captions, if you don't see them on your screen, if you look at the bottom of your screen, to the right-hand side, you'll see a little CC graphic, and it says closed caption. All you really need to do is just click on that, and you'll be able to see the subtitles, and you should be able to see them along the bottom. We're not only going to close caption this particular webinar, but we'll make the transcript available as a follow-up on the follow-up website. This is a serious subject, and I'd like to have everybody take it seriously so that we have good questions and we get a lot of interactions. We're here for you. We're here to answer your questions. So please feel free to do that. And the best way of doing it is on the bottom of your screen, actually right next to the closed caption, is a little button that says Q&A. Please feel free to type your questions in there. And the reason we point that out is because we're going to be monitoring the closed caption portion of this. And we're monitoring the Q&A. And if we don't get to your question during the presentation, we'll get to your questions after the presentation. We'll try to make it when it's appropriate, but we clearly want to be able to address and have you be able to get your questions answered. I have today a couple of gentlemen that are joining me that are doing a great job, and one of them that's a real trooper, and I'll introduce him probably first. Joshua Littrell is with Veterans for Cannabis. He was in Georgia driving down here, and because of the ambiance of the weather, you are in a car. Is that correct, Joshua? So please introduce yourself and tell us a little bit about yourself.
Yeah, absolutely. Thanks, everybody, for tuning in today. Marc, thank you, as always, for putting this on. Zack, for just being a part of this. And the audience, really appreciate you guys bearing with me as I travel down. Plan was to get here to Florida a little bit earlier so I could set up and do the webinar for you guys in a fixed stationary place, but that didn't happen. So we're just going to wing it and make it happen on the fly. And Marc and I have done these pretty substantially over the last few months. And it's something that, you know, is really near and dear to my heart. I'm a combat veteran myself, United States Air Force, served 6 years, couple tours overseas, and really, you know, have fought for the last 10 years almost to bring medical cannabis to the forefront as a treatment option in our veteran community, and also to really bring to the top that veterans aren't the only ones that suffer from PTS. Civilians do too. Whether it's sexual trauma, car accident, you know, familial issues that come up, we're not the only ones in the veteran community that suffer with post-traumatic stress. So that's something we want to really bring to the table tonight, let everybody know that this is for everybody, not just for veterans. So, Marc, thanks so much for the platform, and we really appreciate you all attending tonight, too.
Yeah, and first of all, I want you to be safe, okay? Just
yes, sir.
Slow down, be safe, pay attention to the road. We want you on this side of the grass, and thank you for your contribution. I think not only you're going to be chatting about PTS from a veteran standpoint, but also non-veterans. I know you've been involved in a number of projects on that as well. The other co-host tonight is Zack Swan. Zack is from MÜV. Zack, I'll let you introduce yourself, and thank you very much. Please tell us a little bit about yourself and MÜV.
Yeah, absolutely. You know, I'm definitely honored to be here. I think it's always great to see when people are taking time out of their schedules to learn more about cannabis and particularly this subject with how it relates to veterans and PTSS. So, you know, my name is Zack Swan. I'm the Director of Sales and Marketing for AltMed Florida, who runs and operates the MÜV group of dispensaries in the state. I'm coming up on almost 3 years with the company. I was also the sales director out in Arizona before transferring over here. My responsibilities with the company are primarily community outreach and education. You know, most of my focus is actually directed towards physician education. So I work really closely with with individuals like Marc and the MMTC clinics to provide them the latest and greatest, information on cannabis as a treatment regimen. And it's just something I'm personally very passionate about. My brother suffers from ALS, Lou Gehrig's disease, which is a very tough and debilitating disease. And the only, real improvement he's been able to see in his life has been from medical marijuana. So it's something I very strongly believe in, and really honored to be here and hope to provide some information and answer any questions.
Super. Zack, thank you. And I'm sure during our presentation, we'll be talking about a number of different things. It's important to understand what we're going to do is I don't want to make this slideware. I want to make this something that is based on information. And I want you to feel question that please ask questions during the presentation and use the Q&A button. But I'm going to go, and we have some slides that we're going to go over just to set a baseline of, it makes it easier for us to be able to talk about the different topics that we have. And again, hopefully you can see the presentation now. I just shared it with everyone. I think we've gone through and, oops, let me back up a little bit. We've gone through and we discussed some of the housekeeping issues, but I think most importantly, I should mention that anytime you get involved in medical cannabis or anything that has to do with your health, please consult a physician. It's really important. There's a lot of physicians that will work with cannabis. Some of them won't. I think the best thing to understand is that if you have a physician that's not going to work with cannabis, my suggestion would be to find one that is. I know there's a lot of treatments that are coming on right now. The doctors are getting more comfortable to it, but some of them really aren't. But I think more importantly, this is sensitive material, and really we're all coming together to be able to address this particular issue. Zack, Joshua, I don't know if you're comfortable while you're driving, but one of the questions that you have is PTS and PTSS. Can you tell me the difference between them, or do you want me to go over that?
Yeah, no, absolutely, Marc. I think that's a really great question. And I'll try to slow down a little bit too, so that they can pick up the closed captioning on the bottom as well. So is my video showing, Marc? Are we still good on that?
Your video's showing. You're good.
Beautiful.
And so, we got the presentation showing. Yes.
Perfect. The real difference in PTS and PTSD and PTSS, the only difference is the connotation that comes around with it. So where we say typically cannabis in the cannabis industry, the marijuana word is essentially a bad word, right? Because it's a derogatory term. Well, when people call post-traumatic stress a disorder, it's a negative term in our veteran community because it's technically not a disorder. It is a stressor brought on by a particular situation that was put in a very stressful situation. So it's post-traumatic stress syndrome that we like to talk about, not post-traumatic stress disorder. That's a great question. And that's really the only difference between it, other than, the therapies that go along with it. One's clinically diagnosed, one is not. And PTSS is the one that's clinically diagnosed. So that's really the only difference behind it.
Well, but it's something that, let me go to the next slide. It's something that's been around for a long time. I know you can't see the slide. Normally you present it, but what I want to point out is that this is, although PTS is new for us because we're paying more attention to it, it's been around for a long time. And there's evidence that in the 16th century, they were using something called bong to be able to help with battle fatigue. In the 9th century, the Persian doctors were using cannabis for migraines and basically the juice of the cannabis flowers to be able to help their soldiers. It was actually used during the World War II. During the Civil War, to basically reduce the dosing of opioids that were being taken to treat severe pain. Of course, World War I and World War II, we had battle fatigue and or shell shock. But it wasn't until 1980 that the term PTSD became what they call codified. That's a way of basically saying it was diagnosed as a disorder. It doesn't make any difference what you call it. It's all the same thing. And obviously Vietnam War brought that out. But I think it's important that if you're suffering from PTS from a military situation, this is nothing new. And I can tell you that my father was a World War II vet. He fought for 4 years in the South Pacific. Out of the 52 men that were in his battalion, Only him and another gentleman lived through the war. And so he obviously, especially in the South Pacific, he came home with, we just learned to live with it, and he learned to live with it. I don't think there was a lot we could do about it, but the point is, you're not abnormal. It's something that is normal, but that can be treated. Joshua, also you mentioned that it can happen if you've had an auto accident, if you've been beaten, if you're in a bad relationship. There's a number of other things that bring those stressors about. Can you describe a little bit about what you see, Joshua, as people who have PTS?
Yeah, absolutely. So a lot of times, and I'll tell you all right now, the biggest issue that we're facing with COVID going on is the fact that, they tell us not to pull back and not to isolate from people during our normal day-to-day operations. So some of the symptoms are self-isolation, the inability to communicate, the inability to have a drive or desire. So those are some of the things and the key, components that you can notice in somebody that has post-traumatic stress, a complete mood change. Now, granted, depression can a lot of times go along with post-traumatic stress, and so can anxiety too. So that's not something that's new, and you can keep yourself abreast of what's going on in the situation if you think someone is suffering from post-traumatic stress. And really, Marc, you mentioned it earlier with, your father, your grandfather, and it was called shell shock back in the day. Well, now we know what it technically is the term is with it. And the key is to recognize it and get treatment. And the biggest thing that you can get from this entire meeting tonight is talk, open up, and communicate. That's what this is all about, because you can communicate and get better from post-traumatic stress with therapy and opening up and talking and discussing.
I think a lot of the other, you mentioned those symptoms. I noticed there's other symptoms, like you mentioned stress, you mentioned anxiety, but also that people have trouble sleeping.
Oh, absolutely.
The nightmare of migraines in the migraine type of situations.
Yeah, and mine is I have night terrors. I wake up from a night terror in the middle of the night, thinking I'm in the middle of the desert again in the war zone. So that happens. I've seen some of my friends, both men and women, be in a situation where they're in the middle of an office, completely secure setting, and just completely stop and go completely numb. I mean, hair on their arms raising up because they feel like they're under attack, and it has nothing, there's no stressor at all around them. So it can happen anytime, anywhere, in any situation.
Yeah, and I think addressing it with other people and getting help really helps. And I mention it because when we talk about can PTS be helped by medical cannabis, the symptoms of things like anxiety, like stress, like sleep, you mentioned, night terrors, those are all known to be something that the cannabis can help with. And obviously there's thousands of people, again, both veterans and non-veterans, that have suffered from this. And it's something that we have a lot of what I call anecdotal testing here in the United States. Outside of the United States, I know I work a lot with the Israelis, and I work with the French and the Spanish and a few other groups. They've done a lot of studies on this, especially the Israelis, and it's been proven to be quite effective. So I think
and Marc, I wanted to bring up too that the Israelis, I fought with some really great different forces from around the world, Israelis, Canadians, all kinds of people from the Kuwaitis. But the Israelis have CBD in their med pack because there's a direct reduction from a TBI, a 30% reduction in recovery time after a TBI, which is a traumatic brain injury. And oftentimes you have PTS that follows a TBI. So if an IED goes off, a bomb goes off, and they have a concussion in your brain, and they administer CBD immediately, they have a 30% reduction in recovery time, meaning they get back to the fight quicker so that we can take care of the enemy. So Israel leads the world in cannabis research. You're 100% correct with that.
Yeah, and I know they also use it quite a bit. Again, when you get on a bus in Israel, they have people with machine guns because of the fact they live in essence, a quasi-war zone. And I know that a lot of those folks are using CBD as well, to be able to just basically calm themselves. And it's very interesting. And they seem to be doing a great job of managing it. I know it's becoming a lot more prevalent in Canada as well. But I think it's important. I want to talk a little bit about medical cannabis. I want to talk a little bit about the endocannabinoid system. And I don't know how many people know what that is, but every human being has associated with your nervous system, you also have a parallel what they call endocannabinoid system. And the endocannabinoid system is very interesting in that throughout our bodies, we have CB1 and we have CB2 receptors. And what's really interesting about that, the CB1 and CB2 receptors, is that they're throughout our body. And it's people have told me that cannabis works like the soulmate for these receptors. Specifically, let me just mention what the endocannabinoid system does is it basically affects your pain, your memory, your appetite, your inflammation. It modifies your mood, which is really important. And when it was discovered, especially in the 90s, it was very interesting to see the impact that it had on people. CB1 receptors, which are the blue ones that you see here, are mainly found in the brain and the nervous system. And CB2 receptors, which you see here, are mainly found in your peripheral organs as well as your immune system. But what's interesting is this is how your body functions. When you have a problem, your nervous system finds out that you in fact do have a problem. And what it does is it sends, let me be very specific. What happens is that when you have a problem, your brain will say a problem like whether it's inflammation, whether it's pain, mood, whatever it is, your brain triggers that. And it triggers endocannabinoids. And those endocannabinoids are sent through your blood system into that part of your body to help address that particular situation. Now, in many cases, you may not have enough endocannabinoids in your body. And I'll speak of myself. I'm a senior citizen. And I think anybody who falls in my category, we don't produce the endocannabinoids like some of you young bucks do. And so what we need to do is we need to get some endocannabinoids in. I know I myself I put my body where my mouth was about 2.5 years ago, and I had a left knee replacement operation done. And I worked with Jewett Orthopedic, which is here in Orlando, Florida, to be able to use cannabis as a post-surgical treatment for cannabis. In other words, I didn't use Percocet. In the hospital on Monday when I was operated, I had Percocet on Monday and Tuesday, but on Wednesday I stopped taking pharma drugs. And now I have to tell you, when they let me out of the hospital at about 1 o'clock, I was in a lot of pain. And I literally went to the parking lot with my wife. I used some tincture drops, and then I took 2 hits off a vape pen. And literally within 2 minutes, before we hit the street, my pain level was down to a 1. And that's an example of being able to augment, because my body could not produce enough endocannabinoids for the situation to be able to help and to augment that. And that's where you hear about the buds, the tinctures, the extracts, things like that. And that all goes in and mixes, your body controls those as well. Now, I won't point out that there are synthetics that you'll hear about. I'm not a huge synthetics fan, but there are a couple like Marinol that does work under a doctor's care. It does have some great medical properties. It does not have any THC or any CBD in it. It's THC only. So it doesn't give you the entourage effect, but it is something that is used by doctors, and just be aware that it's part of that makeup as well. But all of those go into the endocannabinoid system in your body. And again, that helps regulate pain, appetite, pleasure, mood, that type of thing. So your brain says we need some endocannabinoids. If you augment it with plant-derived endocannabinoids, all of that goes into the fatty acids in your body. And that's important to understand, because there's a perception by people that cannabis goes into the CB1 and CB2 receptors, and they don't go there directly. What it does is it goes into your fatty acids. When your brain, when your neurons, your nervous system says there's a problem, there's inflammation, there's pain, there's whatever is there, what it does is it breaks those fatty acids down into long-chain fatty acids. And then what the body does, it produces the endocannabinoids and sends that through your bloodstream to that part of your body that needs to be addressed. Now, that is really important for 2 reasons. Number one, no one has ever died from the use of medical cannabis or from using cannabis at all. And the reason for that is because it's your own body. Excuse me. It's your own body producing the medicine. It's not a foreign substance that's coming into your body. And this is why it's not killed anybody. It's your body. All it's simply doing is helping your body heal itself. That's important. The other part of it that's interesting is because of the way it works, your neuron knows there's a problem. If you're treating it, for example, for pain, let's say I'm treating it for pain in my knee, if I have some inflammation in my elbow, it will also address the inflammation in my elbow. I have a case where my mother was taking it, or is taking it. She's in remission for breast cancer. And when she started taking it about 6 weeks after she started taking it, she went to the doctor for glaucoma, and her glaucoma was gone. And the doctor, I said, what are you doing? And she said, I'm taking medical cannabis. And when she came home from the doctor, she said, I didn't know it worked for glaucoma. Well, of course it did. But your body knows its problems. Your body knows where your problem is, and your body does everything it can to possibly address that. And that's what's important to understand. This is natural. The good news is that your body treating itself. Now, the bad news is every body is different. So dosing is different for every person. It's not like taking 2 pills, 2 aspirin, and call me in the morning. You have to be able to get the dosing right, and that's one of the tricks to medical cannabis. But I can tell you, if you get it right, it's a huge relief. So the question is cannabis effective? And besides the anecdotal studies of literally thousands of not only just veterans but PTS, there's been a number of studies that are out there, and I'm not going to go through each of these because there's so many of them. You'll see we're going to give you a list of articles. As a follow-up, you'll get an email, and you'll be able to go to our website. You'll be able to see these studies. You'll be able to read them. You'll be able to look at them. But I think there's a couple of them that are really important to point out, and that is that in 72% of the patients, it got rid of a lot of the nightmares or what you call the flashbacks, and helps people sleep. That is important.
Mark, let's expand on that a little bit too. So that ability to relax and sleep is a huge component to recovery. People oftentimes will have PTS, they have anxiety, they can't sleep during the night, and then that exacerbates the issues tenfold. So having rest and getting your circadian rhythms in the rhythms that they should be in is absolutely paramount to getting your body back to homeostasis. So that's that equilibrium that we all want to make sure that we're running on new gas every day. So Marc, what you're talking about with those studies and them focusing on the ability to relax and go to sleep and stay asleep, that's a huge component to what medical cannabis brings to the table, and the ability to manage PTS itself.
Yeah, and I know a number of people, I know that one of the studies that came out, and this was done out of California, again, Yale, NYU, is they found out that PTS also can be attributed to what they call a deficiency in the endocannabinoids in your body. In other words, you don't have enough of them. Hence why using plant material and things like that are really important for you to be able to augment that. But those studies that are out there, I think one of the things that's important to understand is that if you are with a doctor and you are taking PTS treatments, I know the VA is great at throwing a lot of pills at you. You've really got to work with a doctor to help you work on cannabis and also reduce the number of opioids that you're using, because cannabis will help you do that. It'll help your body get back to a state of homeostasis, but it's important that you address that with your doctor. And I know some doctors do and some doctors don't. It's important to have a doctor that will really work with you on this. And you've seen that a lot of times.
One of the things we need to touch on, I think some of the listeners may not understand, is the VA, and if you're a veteran paying attention, I think you know, the VA does not give recommendations for medical cannabis. So unfortunately, those in the veteran community that are on the webinar tonight are going to have to find a physician that's a local physician and pay out of pocket, unfortunately. So that's a good point I wanted to make sure that we brought up.
Yeah, I think it's important. But again, work with a doctor, but find a doctor that's sympathetic to medical cannabis, because if you have a doctor that's not, it's going to make your life rather miserable. Let's put it that way. I'm gonna go to another. Let's dig into what cannabis is. Zack, you've been quiet. You've been quiet in the background. Tell us a little bit about cannabis. You know, I know you hear about CBDs and THCs. What's the difference, and how do they affect the use of cannabis and PTS?
Yeah, absolutely. And, you know, Josh and Marc, feel free to jump in at any time. But, you know, as far as the plant goes today, the medical cannabis plant, the 2 primary cannabinoids that, you know, we're focused on and are being regulated in the state today are CBD, or cannabidiol, and THC, or tetrahydrocannabidiol. And so CBD can also be found in hemp. You know, these are cannabinoids that exist in the plant, and THC is, however, unique to the cannabis plant. And so CBD is considered non-psychoactive, which I think sometimes can be a bit misleading. It's non-psychoactive in the sense that it doesn't cause the traditional idea of psychosis, the feeling of quote unquote being high. But CBD can cause, it does have an effect on the brain in a lot of ways, in a lot of positive ways, and that being primarily reducing anxiety. And then THC is the more well-known traditional side of cannabis that can cause that traditional feeling of highness or psychosis. But THC is really much more geared towards pain reduction, as an anti-nausea medication, and on the flip side can also stimulate appetites, and can be great for muscle spasms and neuropathy, things of that nature.
Yeah, here's that famous CBD wheel, and if you take a look at on the left-hand side, the CBD products that come from either hemp or come from CBD, those particular products do have medical properties to them. I think that from what I understand, the marijuana-based CBD products have about 108 medical properties. Is that correct?
Yep, that is correct. And from a chemical standpoint, CBD from hemp, CBD from the cannabis plant is not all that different. But what I really stress for patients and just general consumers is to do your research when it comes to CBD. When the Farm Bill was passed in 2018, it kind of opened the floodgates as it relates to CBD. And unfortunately, there's a lot of people taking advantage of that space that are manufacturing or selling or distributing products that just aren't what they claim to be. And until the FDA steps in to issue guidelines, it's a completely unregulated space. And so I certainly encourage patients, if they're not going to buy CBD from a medical marijuana treatment center in the state, and they're going to buy it over the counter, that they definitely do their research on what they're buying.
And what you might point out is that Nikki Fried here in Florida, as of January 1st, every bottle of CBD that legally can be sold has to have a label on the side that if you take your smartphone and put it up that label, it'll show you the testing that's been done on that product.
Correct. Yeah. And I really do believe that, over the next 5 to 10 years, you are going to see Florida lead the way in a lot of areas when it comes to hemp, not only in the growing of it here in the state, but ultimately the production of CBD here. And it's really exciting to see what Nikki and her department are doing.
Yeah, no, it's great. And I think it's important to point out that THC also has medical properties. In fact, if you mix CBD and THC together, cannabis as a plant has over 450 medical properties associated with it. And I know that in certain cases, for example, in my case, I was using it for pain. You have Delta 8 and Delta 9, which is great for pain. You over here mixed with some of the CBGs and some of the CBGAs and that help with pain. It's almost like 1 and 1 is 3. And I can tell you the CBD, the products that I was taking for pain as a post-surgical, for post-surgical treatment was more effective than Percocet. And I was partnered with 5 other people as a test. 4 of them were taking pharma drugs. I was taking medical cannabis. And, we were very straightforward about what worked and what didn't work. My level of pain stayed usually below 1. I'd wake up in the morning at a 7 or an 8. I typically keep it to a level of 1 or below, which is what I've done now. And of the 5 people, 2 of them switched to medical cannabis within 45 days because they got tired of the side effects of the Percocets and the pharma drugs. One person, by the way, just dropped out, so I'll let you know. So it was a true test. But it's something that where you see the entourage effect come into play is when the THC and the CBD work together. Again, there's a very powerful combination. And you've seen that quite a bit, right, Zack?
Oh, absolutely. The at least at MÜV, with pretty much every product category that we offer, we do offer that product in a 1-to-1 ratio. So having that equal balance of THC and CBD and really highlighting that entourage effect for the most part, for most conditions and most patients, I highly recommend that they consider or at least begin a regimen using a 1-to-1 product.
Right. And it's something that it's not enough THC that's going to get you high. You still can operate, but it's enough to be able to medically help you. And that's the key. It's finding that balance.
Right. Keeping that CBD, in conjunction with that THC is going to help offset some of that psychosis that you would typically be a side effect of THC if you consumed it on its own.
Right. And that's an important part.
And Marc, let me go ahead and I'm going to second that, Zack, because I think everybody that's new to this cannabis industry should absolutely either start with a CBD, high CBD, low THC, or that 1-to-1. That 1-to-1 that Zack just mentioned earlier is a perfect starting point for almost every single patient. You can get into it slowly, start low, go slow, and understand what your therapeutic level is as you move forward. Great point, Zack.
Absolutely.
Yeah, 1-to-1s are very important. I know in my particular regime, when I wake up in the morning with pain level of a 7 or an 8. I do take, when we get into the dosing, we'll talk about what we do. But within 3 minutes, my pain level is down to a 1. And my middle of the day regime is a 1-to-1 tincture drop. I continue to use it because of the effectiveness of it. But there's hemp and marijuana. You want to contrast the two, Zach?
Yeah, absolutely. So a same family of plants, but different species, as you can see from Marc's picture, and ultimately they are grown very differently and treated very differently. But the hemp plant, as you can see there, does not flower. So with medical cannabis and the medical marijuana plant, the Cannabis indica, as it's often referred to, we do primarily focus on just female plants, and so the female plants are the ones that flower. So we don't grow males, and the flower, or the bud, as it is often referred to, and what you can see on the screen here is often referred to as a cola. That's really where the medicine lives. And so within that plant, you've got a number of different chemical components that all contribute to that entourage effect. So the trichomes here that Marc is highlighting is where a majority of the cannabinoids like to live. And on top of that, you're also going to have the terpenes, which are essential oils. And I know we're going to talk about that a little bit later. The other thing that exists in those trichomes that's not highlighted here, but I do think is going to continue to become more and more important as more research is performed, is flavonoids, or cannaflavins. So flavonoids are another piece of the plant that are incredibly important, and the flavonoids that come from the cannabis plant are called cannaflavins. And there's some really exciting research that's starting to come out about those as well.
Yeah, and we're learning a lot. I mean, I got in this industry about 6 years ago, and it's changed a lot from the standpoint that we've learned a lot more. And we'll talk about that a little bit when we talk about the different concentrates and things. But one of the things I did, somebody told me, is that in order to be able to produce a bottle of hemp oil, hemp CBD oil, it takes 8 plants, where it takes, in the case of marijuana, it takes about a half a plant. So the cost of a good hemp product is not, there's a perception the cost is going to be cheaper. And many people get sticker shock when they look at hemp because they find out it's as expensive, and sometimes more expensive for a quality product than marijuana. I think it's an illusion that we need to take a look at. Let's talk about when I got involved in the industry, everybody told me about sativa and indica. Zach, that's where we were about 5 or 6 years ago.
Yeah, I love this conversation.
Pardon?
I love this conversation.
Yeah, as I say, a long time ago in a far, far away world, it was in one of those. You want to talk a little bit about that?
Yeah, I love talking about this. Yeah, so sativa versus indica. 30, 40 years ago, when cannabis was really just starting to be grown here in North America, there was definitely some clear genetic differences between the plant. They looked very differently, they grew very differently, and they had different effects. Fast forward to 2020, and a lot of those differences have changed. The plants have been crossbred and crossbred and crossbred and crossbred over and over again. So really every plant that's out there today is a hybrid. You really don't see those true distinct genetic differences of a cannabis sativa or a cannabis indica anymore. But that does not mean that the plants are not different. And so what really differentiates the plants difference today is not, this indica versus sativa classification that's kind of become common culture. What it really comes down to is the terpenes. And so terpenes are essential oils. They exist in every plant in the world. But what's really fascinating to me about cannabis is there's this massive concentration, and not only just an overall quantity of terpenes, but in variety. Our R&D team continues to identify, I think we're up to 13 terpenes that have never been identified before, that are called sexaterpenes. And so they're very difficult to identify without some very specific equipment. But what we're starting to see today is when patients say that this indica strain made me feel very tired or very physically affected by it, versus the sativa that felt very stimulating, what we're finding is that the sativa plants have a lot of limonene in them, as an example. And limonene is a very energizing citrusy terpene, and indica plants typically tend to have a lot of high concentrations of linalool or myrcene, which are medically proven to be very sedative and calming and relaxing terpenes and essential oils. So really not about the sativa indica. You'll definitely see that language still out there in the market as kind of the education and the general population catches up. But I really encourage patients as they start identifying strain-specific products that seem to benefit them, ask their med tenders, ask them the MMTCs that they're buying for, what is the terpene profile of this strain? What about this strain seems to be benefiting me? And so once you've identified those certain terpenes you're looking for, it's going to be much, much easier for you to find a variety of strains that may be beneficial. I always caution patients to, particularly when I first got to this market and it was relatively new, I noticed patients becoming very attached to specific strains. You know, they would have Granddaddy Purple, and you know what? Granddaddy Purple is the only strain that's ever going to work for me. It's the only strain that's going to take away my anxiety. It's the only strain that's going to make me feel better. And that's just really not the case. There are probably a lot of strains that have very similar terpene profiles that are going to do the same thing. And the reason I tell patients to not get too attached to a particular strain, at the end of the day, this is a plant. It's a living thing. We would love to tell you that every day it's going to be available and it's going to be the exact same every single time. But we can't. It's nature. And as much as we'd like to control it as human beings, there's only so much we can control.
Yeah, I should point out, and I'm going to talk as a patient. When I first, I was in an automobile accident 4 years ago, and that's how I started becoming a patient. And I ended up with 2 herniated discs in my back, but I ended up with 7 in my neck. You know, when a doctor comes in and says, "You're now my PB, my personal best," I've never seen 7 herniated discs in the neck. Done 6, but not 7. That's not exactly something you want to pay attention to, or some of you don't want to be in that category. But I was, and there was really not much they could do. They could give me a lot of pharma drugs, and I tried them for one weekend, and I literally almost couldn't sit on the couch. It wasn't good. And I got my card. I got into medical cannabis. I've been in the industry studying it, but I hadn't really been a user. And when I went to the dispensary the first time, they recommended some products, and I tried them. And like you mentioned, I started with the 1-to-1s, and you go low, you go slow, you find out what works for you and what doesn't work for you. But about the third time I went back, I got bold enough to say, how do you know out of the products that you have in this dispensary? And when you walk in, it's almost like, I grew up in San Francisco. We had these Chinese doctors with thousands of boxes behind them with all this good stuff in there. And when you walk in, it can be intimidating walking into a dispensary, seeing all the different products. How do you know out of all those products what works for me? And what you mentioned, the bud tender looked at me and said, it's very simple. Based on the condition that you have, based on the recommendation for your doctors, we have cannabinoids, we have strains and terpenes to address that particular situation. And that's how we recommend them. And the light went on. This is medicine. This is exactly what medicine is all about. You're being able to take those strains and those terpenes and being able to address my situation. And by being able to basically experiment with it, meaning when it didn't work up to dosing, either in quantity or amounts or changing to a different product, I'm able to find my sweet spot. And I can tell you, once you do that, you really get your life back. In my case, it took about, from that first initial accident, it took me about 6 weeks to get my sweet spot. But I was basically operating pain-free 2 days after I started with medical cannabis. What I'm trying, I shouldn't say pain-free, with significantly reduced amount of pain. Let me put it that way. So, you know, the work that the dispensaries are doing are great. Listen to your doctor, listen to your dispensary, listen to your body. Your body will tell you what you should be doing. Let's talk about terpenes, because that's really an important part here. And I'm sorry I got this thing cut off here over here, but the terpenes are important. There's different profiles, and maybe Zach, you want to talk about that a little bit?
Yeah, absolutely. So like I said before, you know, terpenes are essential oils. So lavender, whenever I tell people lavender, everybody's heard of lavender, and lavender is an essential oil. So it's the most common, you know, chemical, you know, product really found in the plant world. And it's just so fascinating to see how many different types of terpenes and in such large quantity exist in the cannabis plant. And, you know, we definitely strongly feel they're a major contributing factor to the medical benefits we see from this plant. And so when we talk about the entourage effect, we're not just talking about the THC and CBD, but we're also talking about the terpenes and how they contribute to the specific effects. And, you know, the terpenes that Marc has on the screen, these are some of the most common. The other things I really like about terpenes and focusing on that is that where, you know, the research for cannabis isn't quite where we want it to be, and that we don't have a ton of, you know, gold standard, double-blind, placebo studies, you know, indicating their specific medical benefits. there is thousands of articles of research and peer-reviewed journal articles on terpenes and their medical benefits. And we have absolutely proven through research that terpenes do have medical benefits for us. And so, you know, alpha pinene is a great example. It's very, very commonly shown to be an amazing anti-inflammatory. And I have found that inflammation seems to be one of the most common problems for pain in individuals. They don't often realize it's inflammation, but that does seem to be one of the most common causes of pain in a lot of cannabis patients.
Yeah, the terpenes are really, really important. I didn't quite understand it when I first got into business, but when I went and I got a degree and I became a practitioner, I got a license, a practitioner from the Holistic Cannabis Academy. And in going through the studies, it was really interesting to see the effects that terpenes can have. It's there. Let's talk about a few of the terpenes themselves. Let's talk about limonene. Zack?
Yeah, so limonene, I think I mentioned before, it's definitely one of the most common terpenes you're going to find, particularly in cannabis, what we would traditionally call sativas. So oftentimes if a company is marketing it as a sativa, you know, ourselves included, that is typically a strain that is going to have a high level of limonene in it. We often see limonene being incredibly successful for conditions like anxiety and depression. Depression in particular, we carry two sativa strains, Tianji and Maui Wowie, and we've partnered up with a company called Strain Print that I'll talk about a little bit later. And with that app, we have shown an 87% reduction in depression using those two strains, which from a traditional pharmacology standpoint, any physician that saw those amount of efficacy would be jumping up and down. If you look at like a traditional SSRI or a benzo, you know, you're thrilled with a 40% reduction in depression. And so to see something nearly double is really amazing.
Yeah. One of the things for PTS that we should be careful of is pinene. Do you want to explain that?
Yeah. So again, you know, particularly with PTS, and then I think Josh can probably expand on this. There are aspects of cannabis that are incredibly beneficial, but people always need to be cautious. This is a drug that you're putting into your body that is going to have some sort of reaction in your body. And so, you know, alpha pinene is a particular terpene that a lot of patients, particularly who are suffer from anxiety, seem to have increased anxiety when they use a product that has a high concentration of alpha pinene. And again, that's why I really encourage patients to ask those kind of questions. Don't just walk in and say, hey, can I have a sativa or an indica? Try to find out what kind of terpenes that are in there. Because again, as we've talked about, sativa versus indica can make a lot of different things.
Yeah, and Zack, too, you know, the key on medicating, when we look at pinene, we look at linalool, we look at all of them, is to, one, look at your situation. So if you're about to go to bed, don't, you know, utilize a lot of limonene, right? But you want to use something that's relaxing and sedating, and really determine what is best for your body. Some people are allergic to things. You'll notice that if you use some vaporizers, you'll sneeze immediately. You know what? There's probably a terpene in there that you're a little bit allergic to. So I think what you guys mentioned earlier about the lab analysis, understanding what your product is made of, is key in all of this therapy that we're talking about. If you don't know what's in it, you can't repeat it and replicate that experience if it's a good experience and a therapeutic benefit for you. So great point.
And I can tell you, in my case, I want to have a regime, a daily program that I can replicate and know it works every day. I need to be able to get up in the morning and drop my pain level down to below a 1 to just be able to do my business, just to be able to run my business. You know, I work with, I think I have 5 websites now and 6 social media networks. There's a lot. I can't be high. I can't be, I guess I could be, but you know, you to do the quality job that you need to do, you need to be lucid. But I can't do that if I'm in pain. If I'm in pain, it does affect my performance as a human being. So I think it's important that we all take a look at how to get that right. And I think you're right. Be careful of, in the case of pinene, it works against you. And we just thought we'd point that out. Again, we want the pros and cons of what's out there. Now let's talk about linalool. That's something that's very important. Zack, you want to take that?
Yeah, absolutely. So linalool is definitely a very common terpene to be found in cannabis, more, you know, again, traditionally associated with indica strains. And so this is definitely geared towards, you know, pain management. It can be helpful for depression as well. But Linalool in particular, I find to be very effective for patients suffering from insomnia. If you're having a hard time sleeping at night, or either falling asleep or staying asleep, which are two very different things, and I can touch on that a little bit later, I would highly recommend, investing in a strain that's got a high concentration of linalool in it.
Yeah. I know that I know that my wife and I got into some aromatherapies about 2 years ago, and the lavender was something that helped us quite a bit. And then when I found out that I could find it in the cannabis, that was really effective. It's there.
Absolutely.
Let's talk about myrcene.
Yeah, so myrcene is definitely one of the most common terpenes that can be found in really any strain dominance, whether it's an indica, hybrid, sativa, or just depending on what you're looking for. And so again, it kind of seems to be a catch-all from potential medical benefits, whether it's the insomnia, the pain management, or the inflammation. And you can find myrcene in really high concentration in mangoes. So there's a lot of, I've never really seen anything definitive research-wise, but I have seen anecdotally a lot of patients reporting that consuming mangoes in conjunction with their cannabis regimen does seem to some sort of have an amplification of the benefits of cannabis. Now, again, could be placebo effect, but I have heard that very commonly.
Sure. But myrcene is also something that really relaxes you. That really
absolutely. Well, so that's the thing, is it's almost a chicken and an egg. Did you fall asleep because it made you tired, or did you fall asleep because you're relaxed?
I had a medical doctor, my knee doctor, and I talked about this. And I actually after the operation, normally what happens with the pain, you don't get a lot of sleep. And all of a sudden I was starting to sleep after about 6 months. I was sleeping more than I was before. And what happened was my body that had been in pain literally for over 25 years because of the knee, the pain wasn't there anymore. I mean, when you wake up from an operation and that pain that had been literally stabbing for a long time was gone, it was really shocking. And your body just kind of relaxes, just kind of goes, I don't have to put up with that. I don't have to manage it. And that's where a lot of what they call the sedative effect, the relaxing effect comes from, is your body is not having to work so hard to be able to control the anxiety and try to manage that pain that's out there. And that's where myrcene comes into play. It's a very important part of that. But let's talk about how you can take it. I know that when I got into business 6 years ago, I couldn't perceive that we'd be sitting on the front porch smoking a fatty, excuse the term. I think we've come a long way with it. There's a lot of different ways of taking medical cannabis, and a lot of it's personalized, what people like and what people don't like. And here's some of the products that are here, but I think let's talk about it from the standpoint of how they're used. Zack, you want to walk us through this?
Yeah, absolutely. So depending on how you're going to consume your cannabis, and as you can see on this screen, there are a lot of different ways to consume it today. Is going to have a very different impact on how long it's going to take. So it's onset time, as we typically refer to it, and then its duration of effect. So ultimately, that's really a personal decision for every patient. Are you someone who needs relief quickly? Are you someone who needs relief on an ongoing basis? So what's working for someone who suffers from migraines is not necessarily going to be the right regimen for someone who's got a herniated disc and is going to need continuous pain management support. So I really encourage patients to kind of understand what your end goal is. Is this something that you feel you're going to need to use on a daily basis because you've got something, whether it is PTS or it is chronic pain that you're going to need to continually work on managing? Or are you somebody in a similar position that Marc was, post-surgery? You're going to be in a lot of pain for a short amount of time. And so you want to make sure that you can use something that's going to work very quickly to help relieve that. And so, as we can see here, sublingual drops or tinctures is definitely something every MMTC carries. Vape pens are the same way. As you can see with vape pens and flower and, towards the bottom where it says almost immediately, pretty much any product that you inhale is going to have an immediate onset time. You are inhaling those cannabinoids pretty much directly, not directly into your bloodstream and right onto those cannabis receptors, but into those fatty acids. So you're going to start feeling those effects almost instantaneously. Now, on the complete opposite side of that is going to be ingesting cannabis. So ingesting cannabis, whether it's a topical, or if it's an edible, or a capsule or a tincture product, that is going to take much longer to take effect, but it's also going to last much longer. So I have found that patients, particularly in the who suffer from PTS, typically do very well with an ingestible cannabis product because they are going to need something that's going to last for an extended period of time. And Josh, I'll let you kind of talk to that as well.
Yeah, well, Zach, I was actually going to chime in. There's a couple of questions that came in, and I think it's a really good point, perfect time to answer those. So Elaine asks, in your chart, the effectiveness time frame, does that start when you first take the product, or does it start after it starts to take effect? And she has in parentheses, when I take stuff, it takes a long time before it takes effect. And I'll answer that, and then Zach, I'd like your opinion too. It's your metabolism, Elaine. Each person is different. I know that when I take edibles take forever for them to jump on me. But when they jump on me, they're on me for 5, 6, 7 hours. So it's a much longer effect than what it is with most people. But the vaporizer pens, almost immediately, like Zach was saying. So it's really about your metabolism, how you metabolize the cannabinoids, and how you take that product in. And the chart here specifically is from the time that you take the dose. That's what it's specifically saying.
Yeah, exactly. So yeah, that time to work is I took it and then I started to feel the benefits, you know, sublingual drops as an example, either 15 to 40 minutes later. And again, that like Josh is saying, that depends on the metabolism. One thing I always tell every patient, particularly if you're going the route with you're ingesting cannabis, ingest cannabis on a full stomach. Do not ingest cannabis on an empty stomach. Cannabis is what we consider a very fat soluble compound. And what that means is it likes fat. And so if you do not have anything in your stomach, that cannabis is just going to hang out there and hang out there, unfortunately, lots of times until you eat something. Now there's something in your gut for those cannabinoids to bind onto, and they're going to release very, very quickly. And that, you know, an edible you thought was going to kick in an hour, of all of a sudden is hitting you 4 or 5 hours later because there was finally something in your gut for it to bind onto. So I always encourage patients to take an edible typically about an hour after consuming a meal. And if that meal can be a bit on the fatty side, so something like peanut butter or meats or cheeses, that's just going to help the onset time be a bit faster as well.
That's a good tip. You know, I in the morning, I get up, I take some sublingual drops, and I know it's going to take me, in my case, it takes 20 to 25 minutes to work, but I immediately hit a vape pen. And the reason for that is because as my pain level, as high as it is, I want to get that down to a reasonable level. And I can, one of the things that is remarkable to me is when I hit the vape pen, I can feel the pain immediately go away, like within 1 or 2 minutes. And the first time that happened to me, I remember saying to my wife, this is kind of weird, that it felt like somebody wiped my back and the pain went away. In fact, every day that I do it, in fact, this morning when I did it, I'm just amazed at how fast it works. I mean, within 3 minutes, my pain level is down to a 1. And if you have a high pain level, this is something that you really love taking advantage of. And again, I use tincture drops and vape pens. Other people use capsules.
Absolutely. Mark, I just want to, point out too, we're talking about pain right now, right? But I would say 90, and I'm guesstimating on this because the Veterans Administration won't give us direct numbers on this, but I would say between 75 and 90% of PTS patients have chronic pain. So yes, Mark and I and Zach are talking about chronic pain right now. If you have chronic pain that's with your PTS, and your PTS is exacerbated because you're constantly feeling the pain because you had an IED blow up and you lost an arm, or you had a traumatic brain injury, and you always remember that because of the pain. If you can remove that pain with cannabis, it helps relieve the PTS symptoms. And that's something a lot of people don't think about.
Yeah, that's a really good point. That's a really good point. All the contributors that are there. One of the things that I think, and I'll compliment MÜV and Zack, topicals. You guys have a great topical product line. I've used it. I used it during my operation. Tell me a little bit about your topicals, and tell me about topicals in general.
Yeah, so topicals, you really kind of have two different categories. You have just a traditional topical, and then you have a transdermal product. And so a topical is exactly what it sounds. It's applied topically to the skin. Topicals are great for localized relief. So as I mentioned before, cannabis is a fat soluble compound. you got a lot of fat in your skin and your epidermis. Even if you're very skinny, there's a lot of fat in your skin. It's just the nature of your epidermis. And so when you apply a traditional topical, what it's going to do is it's going to bind onto the fat cells in that skin. So it's great for inflammation. It's great for pain reduction. We carry a product, a hydrating lotion, which is a facial topical, which can be great for acne, rosacea, eczema, psoriasis. A lot of those conditions are inflammation of the skin. And CBD in particular is just this amazing, amazing anti-inflammatory. I mean, so Josh was talking about it. I had not heard that about a 30% reduction in a TBI. That's just unbelievable. Why that's not in every med kit for U.S. Armed Forces is just nuts. And so those are traditional topicals. If you're a patient who's unfortunately for being drug tested, whether you work for the federal government or for you're a firefighter, topicals are a product that you can safely use without having to worry about a drug test because of that fat soluble aspect of it. It can't penetrate into the bloodstream. It's going to stop right there in the fat in your skin. Transdermals on the other side, the state considers this a topical. I really don't, because a transdermal product is going to get past the fat and it is going to go directly into your bloodstream, and it's going to provide what's called a systemic effect. So traditional topicals just provide local effects, whereas and a transdermal product, very similar to inhaling or ingesting a product, provides systemic. So it's going to be able to circulate throughout your entire body. So if you're trying to deal with something like PTS, you are going to need a product that is systemic. You're going to need a product that's going to break through that blood-brain barrier and provide relief through your entire body.
Yeah, I know. I'm a huge transdermal patch. In fact, I have one on right now. And because in my particular case, I have two different tracks, I try to manage one for inflammation and then one for pain. I tend to go between a THC patch and a CBD patch, because I want to be able to mix it up and be able to have my body not get used to just one thing. But it really helps me because the 72 hours of working means I don't have to, it's easier for me to take my medications during the day. Now, I always take a 1-on-1 during the middle of the day, but in the evenings and in the mornings, it just helps me be able to get things done. And then, of course, now with the quarantine situation, you have more time to work on this. But before, when I was putting on the webinars and working and visiting customers and patients literally 4 or 5 days a week, I didn't have the time to take the breaks to medicate. And I found that one of the things that really helped me quite a bit was the transdermals, being able to stay on track with respect to my medication and my dosing schedules.
Marc, before we move on, Brian Reeves has a really good question, and I think it's a good point to bring it up too. He says he's a PTSD cannabis patient. His issue is that he cannot be at a stable, consistent level with his meds because of his work. And this is something I think we all deal with. He just can't be medicated all day and feel like the anxiety gets high, and he has to medicate on his way home so he doesn't explode on his family. The issues that come up with PTS. He's asking, what can I use that's not psychotropic when I feel the clutter beginning in my head? And, I think it's a really great point. Brian, great question too. And he mentions later on, and let me go ahead before I answer this, that sounds like I need to take advantage of more of the CBD side during the day. I could not agree more. And even the 1-to-1 ratios, Brian, that may be a good option for you. And the key is finding out what works for you. Maybe the transdermals are a really good option for you. And I'll tell you right now, it's all about your personal preference. Marc loves them. I hate them. Transdermals just don't work for me. So it's really about who you are and how your body reacts. But Brian, you're exactly right on that. I think implementing a higher CBD dose and regimen during the day may help you alleviate some of that anxiety throughout the day and not have that kind of combustion feeling that you have at the end of the day.
And Josh, I'll just build off of that a little bit. And so, basically, Brian, what you're trying to accomplish is you want those positive benefits of the cannabis without those negative side effects, right? Of it is causing too much psychosis during the day. And that's kind of the goal of every patient is, how can I consume this and get the maximum amount of medicinal benefit without any of these negative side effects? And so, Josh's absolutely right. Definitely I'll take that CBD during the day, consider that 1-to-1 if that's still not proving effective. But the other thing I think may happen, and I've seen this be pretty common with a lot of patients, over time, you are going to start building up a tolerance to those side effects of that THC. So a dose that you find right now, maybe, causing too much psychosis, 2-3 months from now, that might be the perfect dose for you. So I do always, just like any other new drug that your body is getting adjusted to, it can take time. It can take time.
Brian, it's Emilio asked a good question. When you buy a 1-to-1 product, is there any product that's indica and CBD? Zack, I'll leave that in your wheelhouse.
Yeah, absolutely. So, Emilio, when we say a one-to-one product, and I don't think I did a great job of explaining that, what that means is that there is a one-to-one ratio of THC and CBD. So every product that's described as a one-to-one product is going to have equal parts THC to CBD. So an example would be our transdermal patch. So we carry a transdermal patch that is a one-to-one. And so that means is it has 10 milligrams of THC and 10 milligrams of CBD associated with it. As far as it being indica, then you're getting into a product that is both ratio specific and strain specific. That can be a little tricky to find. We do carry one-to-one vape pen that we carry, a strain called Cannabis, which I believe, and I could be wrong, but I believe it is a slightly indica leaning hybrid. That is also a one-to-one ratio pen. But again, as I was talking about before, try not to focus so much on is it an indica or a sativa, but identifying those terpenes that seem to be getting you the effects that you're looking for. And so if you're looking for an indica because you want something that is sedative, I'd say try and find a strain that's got a lot of linalool and myrcene in it. You may not necessarily need an indica. You just need a strain that's got a lot of those two terpenes in them.
I know that when I work with some patients, I always tell people, pay attention to what your doctor tells you, medical cannabis doctor. Pay attention to what your pharmacies tell you, your dispensary is talking to you about. But I think the most important person to listen to is your body, yourself. Your body will tell you more than your doctor can't guess, and the person behind the counter is only making recommendations. Your body will tell you what works and what doesn't work. And this is something where sometimes you got to experiment it, and there may be a negative effect where you get high, or you try something and it doesn't work. Make the adjustment. Don't stick with it. Make an adjustment. One of the things that people make a huge mistake is they get into medical cannabis, they go low, they go slow. After 2 weeks, it doesn't work, so they stop. And that's exactly what you shouldn't do. Just adjust either the quantity or the quality of what you're doing. Talk to your dispensary, and then also try things and listen to your body. Your body will tell you what works. Because I can tell you, once you get it dialed in, you get your life back, and that's important. And you may need to take a week or two. Have patience. What you're doing is you're doing something that's going to be. This is kind of like taking vitamin pills. You're going to be taking them for the rest of your life. This isn't something I cannot get rid of the herniated discs. They're not going to go away. And so I either got to learn to live with them, or I got to check out one of the two. And I prefer to learn to live with them. Let's put it that way.
And Marc, just one last comment on that. I do always encourage patients, this is a medication that is just so different than any other medication, you've been recommended or prescribed. It really is on every individual patient to take some personal responsibility over what is going to and not work for them. And it could take time to find out what that is. We talked about the endocannabinoid system. Guess what? Everybody's endocannabinoid system is unique to them. And so, what works for Josh, for someone who's got the same PTS condition and maybe had a very similar situation happen to them, could be night and day for that other patient. And that's just because we are all truly, truly unique. And so it does take some patience, and it takes ownership as an individual to be committed to improving your life. And if you're going to be discouraged, just after the first couple of weeks, don't. Talk to your fellow vets, talk to other patients, talk to the people at the dispensaries, and we're going to do everything we can to help you find the path that's best for you.
I know that about 2 months after my operation, we had dinner. We had 5 doctors I was working with, and we had one of the medical marijuana doctors there as well. And my doctor looked at me and he said, "This is so different than the pharma drugs that we prescribe. It's just different. But it works." In fact, interestingly enough, his wife is on it. Okay, his wife had a terrible problem for a long time, and we put her on it. And it's basically helped his marriage and helped his wife quite a bit. But it's just different than take a pill for one particular situation. It's something that the endocannabinoid system, your body will tell you what's there. So it's a matter of just kind of slowing down and listening to yourself. And that's why a lot of people turn to things like meditation, turn to things like music and things like that, to basically, because now you're getting into the nature part of your body, and it does work. It's something that's there. It's there. Let's take a look at. This is some of the reference material that we'll be sending to you after the presentation. You'll get it via email. There'll be a web page. I'm not going to go through each of these because it's just a lot of interesting material that's there. But there's a lot of research that has been done both anecdotally as well as chemically. Zack, tell us a little bit about MÜV, because you do some special things with respect to your products.
Yeah, absolutely. And we have a really big product portfolio. There's I think 14 dispensary companies that are operating in the state today, and all of us are completely vertical. That's the way the law is set up here, where we are required by law to grow, process, produce, test, distribute, and sell everything. So it's a true seed to sale setup. And we all have unique different product offerings. And so I'm not going to go through every single product today. I've kind of tailored some of the product options I'm going to talk about today, specifically as it relates to PTS. But just, very quick background on MÜV. So we are a very R&D, pharmaceutically focused company. Our founder came from the pharmaceutical world. Mike Smolin, his daughter, unfortunately, did suffer from grand mal seizures. And so he had to see her go through that. And, as the years went on, came across the amazing, Sanjay Gupta story on Charlotte's Web that I think has touched a lot of people in this industry and opened up a lot of people's eyes, and was just really blown away by the benefits of this plant. Was shocked at how much it had been demonized. And so he actually came out of retirement to start AltMed Enterprises.
So you're in a lot of locations.
Yeah, that did not used to be the case. We've definitely been a little bit slower to open up stores in comparison to some of our competitors. We really wanted to make sure that we could maintain supply as best as possible as we opened up stores. So through the first 2 years of operation, we had only opened up 11 locations coming into 2020. I'm really, proud and excited to announce we've opened up 12 in the first 7 months of the year. We're going to open up 2 more this month in August in West Palm Beach and Port St. Lucie, and that will bring us to 25. And then we're going to open up 7 more before the year's over, and ultimately hit 40 locations by Q2 of next year. So we'll have pretty much the entire state covered. As you can see, there's a big cluster of them in the Southwest. We are based out of Apollo Beach, Florida. That is where our cultivation is. Our company was founded in Sarasota. So this is definitely kind of our backyard and somewhere that, we really strive to have a very strong presence. But a lot of the expansion over the next, 6 to 8 months is going to be up north in the Panhandle, the Northeast, and particularly in the Southeast. We're going to be expanding quite rapidly.
You said something that's really critical, and that is that you're expanding, but you want to make sure if you open up a store that you can get the supplies and you can get the products that are there. I cannot tell you how many times I've found a product that I liked, gone to the dispensary, and they're out of it. And they're out of it in a couple of locations, not just one. Like that's important.
Yep. Yeah. And we're certainly not unique to that. But I do think we've done a very good job for the most part of maintaining our supply, particularly when it comes to certain product categories that we know we're the only one that offers it. Meter dose inhalers are an example. We're the only company in the state, actually in the country, that manufactures a true cannabis inhaler. And Emilio asked the question about that, how long to get in the system. It's very similar to inhalation, Emilio. So it's an immediate onset time. The cannabinoids actually go directly into your upper bronchial cavity. We use the same propellant that an ibuterol inhaler uses. So the onset time is going to be immediate. The nice thing about the MDI is it's also metered. So you're going to get the same amount of medication every time. It's one thing I always caution patients who are trying out vape pens for the first time. Depending on how long you inhale and how much you inhale each time you do it, you're going to get a lot of variance in the amount of milligrams of medication you're getting. So always be cautious when you're using a product that's not what we call metered and it's not controlled dosing. If you're starting to notice varying effects from when you use the vape pen one day to the other, that could likely be due to the fact that you're inhaling more or less medication.
Yeah, you're smoking. You're inhaling it differently. I've always been told to count to two 1,000s when you inhale, at least to be able to work. Some people have said no, but I find for me that I try to be consistent for that exact reason. So I'm kind of knowing that how that affects my body. Let's put it that way.
And then I'll answer Brian's question real quick. Brian's asking, I have a 16-to-1 CBD vape. Would this be what I need to be using, or the 1-to-1? And again, it really just depends on each patient. if the 16-to-1 is proving to not be effective for you, then yeah, then I would certainly consider taking a look at a different ratio. But if the 16-to-1 is working for you, stay there. There's absolutely nothing wrong with it.
Yeah, Zack, and
go ahead, Joshua.
well, on that, when Brian's talking about his situation there at work, I think the 1-to-1 may be a really good option for him because it doesn't have that super psychotic effect to it. It will allow him to continue doing his job and still function and not be, a little loopy, if you will. So I think that 1-to-1 may be a really good option for him versus the 16-to-1 CBD to THC ratio, where now he's got that 1-to-1 CBD to THC ratio and could be a good therapeutic option for him during the day.
Yeah, I think that clutter, Brian, that you were talking about is that 16-to-1 is just not quite doing the trick.
Yeah, it's a good point. It'll help a lot with inflammation, but probably not help much with the clutter.
Yeah,
so it's there. Zack, you've got some best of class products.
Yeah, we'd certainly like to think so. So I mean, as you can see here, we offer a really wide variety. We've got ingestibles, the transdermal products, smoke-free inhalation like the vaping and the metered dose inhalers, and then concentrates and flower are also an option.
Great. You want to talk a little about your cannabis oil?
Yeah, so these are going to just be kind of some specific products that have had great feedback from patients as it relates to PTS. So RSO is just an amazing product. RSO stands for Rick Simpson oil. Rick Simpson was a Canadian gentleman who was really the first person to really promote the benefits of what's called FECO, or full extract cannabis oil. That's really the term I prefer to use. That's what RSO is. It's a full extract cannabis oil. And what that means is that it is essentially the plant in an oil form. So it doesn't just have the cannabinoids and the terpenes, but it's got the lipids, the waxes, the flavonoids that I was talking about. And all those things together just have an amazing effect for that entourage effect. And there's a lot of people that use RSO oil or FECO oil as it relates to cancer. But as particularly since my time in Florida, I've seen a lot of PTS patients using RSO, and I didn't really understand the reasoning behind it until I met with a physician that Josh is familiar with, Dr. Kirk O'Donnell, who is also active military and a physician, and he was the one that kind of gave me this amazing explanation. But the reason RSO seems to be particularly effective for PTS patients is as a nighttime sleep aid. And so when you have PTS and you have night terrors, a lot of times that happens when your brain enters REM. And so when your brain enters REM, it's able to relive those traumatic experiences. What's really fascinating about cannabis, and particularly RSO, is that it allows your body to sleep, but it blocks your brain's ability to enter in the REM. And so without entering into that REM, you're not being forced to relieve those traumatic experiences and having those night terrors and having those panic attacks. And then I just met with a sleep specialist physician who was just a traditional sleep doctor, and his patients started using cannabis, and he was so blown away by the results that now he's recommending cannabis as well. And so it's just really fascinating to see this correlation between cannabis, sleep, REM, and PTS. Josh, you want to talk about any of that?
Yeah, absolutely. Before we do that, I got a couple questions for you. Elaine says, what is the amount of time that inhalers last? You said onset was immediate. How long does it last? And then what is your oral spray?
Okay, great questions. Yeah, so the MDI lasts, it's very similar to a vape pen, so it's only going to last 3 to 4 hours. Again, any of those inhalation products are not going to have an extended a time of release. But for some patients, that's okay. That's exactly what they're looking for. Our oral spray is another really great microdosing option. And we haven't really talked about macrodosing or microdosing, but microdosing refers to taking cannabis and in a very low THC or very high CBD ratio, where it's very unlikely to cause that traditional high effect. And so the oral spray is just a traditional sublingual spray. It's only 1.9 milligrams per spray of THC. Traditionally, the kind of rule of thumb is if you stay under 3 milligrams of THC, most patients aren't going to experience any psychosis. Not all patients, some patients will. But I really like the oral spray. It's only 150 milligrams. It's a really tiny bottle. It can fit in your pocket or fit in your purse. It's a great product if you're kind of new to cannabis and you want to start out with a small dose. I also like it because it's a very affordable option. It's only $25. And so if you're a little nervous about making a big investment into like a vape pen or something like that, that's a very cost-effective option for someone to try.
Right. Talk a little bit about concentrates.
Yeah, so concentrates are another major product category that I see patients with PTS seeming to have a lot of success. And now, not all patients are equal, and I don't want to lump all PTS patients together, but it does seem a lot of PTS patients require a lot of milligrams of THC. And I don't know if that's specifically for the chronic pain that's also associated with a lot of the PTS, or is it because they need those high milligrams as that nighttime sleep aid? RSO, I should mention, is very potent. It does have a lot of milligrams of THC, but it isn't ingestible. Sometimes you need relief much faster, and that's where concentrates come in. So concentrates come in various forms. You can see some here. We've got shatter. Our blue line is traditionally called crumble. The gold packaging is traditionally called terp sauce. And all these products are cannabis in different physical forms, but what all of them are very high concentrations of milligrams of THC and terpenes. And so what patients are going to get is they're going to get a macro dose, the opposite of microdose, a very large dose of THC all at once. It can be very cost effective. So the average milligrams of THC a patient's going to get from a vape pen, typically, depending on the device, depending on the user, anywhere between 3 to 5 or 2 to 4 milligrams of THC per inhalation. When you take a product like a concentrate, take about a grain of rice of it, you're typically going to get 25 milligrams of medication off of one inhalation. So it's about 5 to 6 times more milligrams of THC off of that one inhale versus using a vape pen. And so if you're a patient, with PTS or any other condition, you find that you are just hitting that vape pen over and over and over again all day long, that's not going to be very cost effective in the long term. And so a concentrate might be a much more appropriate product for you.
Yeah, typically, when you're first starting in cannabis, you don't really get into the concentrates. You're sticking with the vape pens, the tinctures, and shatters. I noticed in my particular case, I got into it. Actually, you were the one who really introduced me to a lot of this, because in my particular case, because of the pain, I need to pay more attention to THC. Now I have a high tolerance of THC, so I'm able to do things, but be able to do this and leave it for pain, especially in the evenings where I'm trying to get some sleep. Makes a big difference. Being able to sleep through the night makes my life a lot better. And I know that the concentrates help me quite a bit on that. So, and you have some encapsulated tinctures as well.
Yeah, so this is actually really, really exciting. So as I referred to before, cannabinoids are fat-soluble compounds, right? They like fat. And so that's not really great when it comes to what's called bioavailability. So bioavailability is, the absorption of the active ingredient into your body. CBD in particular has very low bioavailability when it's ingested. They theorize that typically you're probably only getting about 10% into your body for what you ingest. And so that was really one of the first problems we set out as a company to solve. And so what came out of that, and I used to always have to say patent pending, but we actually just got 9 patents back from the U.S. Trade Office that I'm really, really excited about. So we now have 9 patents on this technology in various different forms. And what AltMed was able to do was to come up with a way to encapsulate those fat-soluble cannabinoids and make them water-soluble. And so that offers numerous benefits. So number one, increased bioavailability. So it's going to have a much better absorption into the bloodstream because it's not going to have to go all the way down into your stomach and be ripped apart by your liver in what's called the first pass of the liver effect. The other thing is that it makes it water soluble. So tinctures are traditionally MZT oil or coconut oil based, and the cannabinoids themselves are also very fat soluble. So if you put a traditional tincture into a glass of water, it's going to separate like oil and vinegar. And that oil is just going to be a nice goopy mess up there on top. No one really wants to drink that. With our encapsulated technology, it makes it fully water soluble. So if you drop a full dropper of a tincture in a glass of water from us, it just fully disperses and completely mixes in the liquid, and you can't even see it anymore.
Some people take them with coffee.
And some people take them with coffee. Yep, because it's completely water soluble and it's going to completely disperse into that liquid, which I think is really amazing. And the other big advantage of encapsulation technology is that onset time. So traditionally, when you ingest cannabis, it's going to have to be fully digested by your stomach. So patients will typically say it's going to take 30 minutes. If you're someone like Josh, it could take 2 hours before you start feeling the effects. With encapsulated product, we typically see onset times anywhere between 15 and 30 minutes, which is just really, really incredible. I take RSO every single day. It's been the best product I've found as a nighttime sleep aid. I was traditionally taking our RSO syringe, but it was, even when I ate on a full stomach, the onset time was typically 90 minutes to 2 hours, which was tough for me because I had to really plan ahead to take it if I wanted to get to sleep at a good time. We now offer our RSO in a capsule that is fully encapsulated. And those, I feel, 30 minutes every single time, like clockwork. And it really blows my mind how consistent and effective it is.
So Zach, we're talking about
Go ahead.
sorry, we're talking about, you know, ingesting things like that. I got two questions for you. Elaine says, how do you ingest crumble and shatter? And then the second one is Emilio asks, he says he recently read an article about how cannabis can help prevent viruses. Is that true?
Yeah, so two really good questions. So Elaine, first and foremost, do not ingest crumble or shatter. I would not recommend it. Crumble and shatter is primarily meant to be inhaled. So crumble and shatter is what's called THCA. So THCA is the acidic, non-psychoactive version of THC delta 9, which is the compound you really want to get in your body. THCA is what exists in the whole flower plant until you combust it, right? Until you use fire or flame or something to convert it into smoke. And it converts from THCA to THCA to THC. Shatter and crumble are the same way. There are large concentrations of THCA until you combust them, typically using a concentrate vape pen, which will convert it from THCA to THC.
Yeah, I should point out this is one of your vape pens here. I think it's your G pen, right?
Yep, that's one of our G pens. Yep,
okay,
exactly.
Right here. And so this is your classical vape pen, but this is one of the pens for shatter and crumble that you'd use right here. And the way that works is the top comes off, and you put it right in here.
Yep.
And this one is called the Dipper. This is one of the better ones I've seen on the market. This is actually this is my go-to here for this particular one. And it works very similar to a vape pen. Where you push the button, you can control the level of the heat, but it works very, very, very easily. And what I love about this one is I can unscrew the top because sometimes things get kind of mucky. I unscrew the top, I drop it in some alcohol, and literally it cleans it off. And I'm not sure the manufacturer suggests that, but I know I've had this pen for a couple of years and it works great.
That is what the manufacturer suggests, Mark. So you are doing it right. Isopropyl alcohol is heavy cannabis user's best friend. Cannabis is very sticky. If you haven't touched an oil or a crumble, it is essentially honey, and you are going to feel like Pooh Bear, just completely covered in stickiness. And so isopropyl alcohol is definitely your best friend. Yeah. Emilio asking about help prevent virus. I think you might be referring specifically to COVID. There are absolutely been some studies and research that indicates that cannabis has some antiviral properties. It's got antimicrobial properties. It's got antibacterial properties. As it specifically relates to COVID, you know, we don't even have a vaccine yet. So if there's people out there claiming that cannabis can, you know, help prevent COVID or reduce it, to me, that's a little unethical and bad science. That's just, we don't know enough. So I certainly wouldn't want people, you know, macrodosing CBD and taking their face mask off and think that, you know, CBD is going to protect them. It definitely has some antiviral properties. Is it, you know, specific to a coronavirus type virus? We simply don't know. And unfortunately, we probably never will, at least for another 10 years.
There's a lot of studies going on. And look, we're all frustrated by this coronavirus thing. There's a lot of reasons why we should be frustrated. You know, there's no magic to the fact that we as a country has mismanaged the way we've handled it. But more importantly, being locked inside, being quarantined, caused a lot of anxiety and a lot of stress. It's helped the cannabis industry somewhat because people use our products to be able to manage those situations. But there is no silver bullet, and there is no magic wand. There is no fairy dust. You know, right now we don't know what's going to be the antidote or what is for cannabis. I do know one thing, and it's going to be this. I feel strongly. And you go back and you look at countries like Canada, you look at countries like Italy, you look at countries like New Zealand. They basically beat the coronavirus. They're down to where they are opening up schools and they are opening up their economies. They don't have an antidote. They had people that just paid attention to wearing masks, social distancing, quarantining. They just followed the guidelines. And when they followed the guidelines, it worked. And you can see these countries opening up and doing well. Canada is a good example. New Zealand's a good example. You know, again, they're not as big as the United States, but when we have states that don't follow the rules, and I'm speaking of Florida, and we're going through what we're going through right now, self-discipline is going to be the key to this. And I'm like everybody else. I'm frustrated. I'm an ex-golfer, you know, and being an athlete, self-discipline is something that you got to learn. And I'm just saying it's just something that unfortunately is there. So I have a slide up of your encapsulated patented technology, Zach. I think that's important. This is what you got your patents on.
Yeah. So this is just, I think, a great visual that helps kind of explain how this encapsulation technology works. So without encapsulation on the right, so there's those non-water soluble or fat soluble cannabinoids. As you can see, that they're not going to make it past that skin surface, that epidermis, that's very fat soluble. And then on the left with the NCAPS technology, you can see that we've completely encapsulated. It's going to go right past the fat in your skin and go straight into your bloodstream. And I think what really surprises a lot of people the first time they use a transdermal product is how fast it works. You can often, particularly with our Evolve transdermal gel, which is more of a macrodosing product, you can start feeling the effects in, as little as 3 to 5 minutes, depending on the patient. And it's going to feel very similar to using a vape pen. I remember the first time I used that product for a migraine, and I was just absolutely blown away how it stopped it in its tracks.
Yeah, it's really, really important. Yeah, you have a good set of products. Strain print.
Yeah, so strain print is something I'm particularly passionate about. I'm as frustrated as every other patient with the lack of gold standard double-blind placebo studies around cannabis. As long as it's a Schedule 1, that's going to be very difficult to do. And but yet at the same time, we hear all this anecdotal data of patients, touting the benefits of cannabis. But as someone who is responsible for providing information and education to physicians, it was personally very frustrating for me for a doctor to say, okay, but what do I give my MS patients? What do I give my PTS patients? What do I give my Crohn's patients? And my response always had to be, well, every patient's different, start them slow, and then see what happens. I would really hope one day we can get to the point where we can give people a bit more of a specific starting point than everybody start with a 1-to-1 and we'll see what happens. And so strain print is kind of our attempt to bridge that gap. So strain print is a data science company based out of Canada who's doing really, really amazing work. And what they've developed is this mobile app that I encourage all patients to download. And what it allows you to do is to create a profile. So it'll capture your conditions, the symptoms you're suffering, your age and your sex, and you're able to go on there and log your medication sessions, which is really important because as we've talked about, cannabis is not like an Advil, and you know what's going to happen and how long it's going to take. It's really important that you kind of track, particularly as a new patient, what's working and what's not working so that you can dial in your regimen. And so the other benefit of strain print of not only having that log so you can keep a better eye on what's working and what's not working is two things. First, there's a community aspect of strain print. So if you're a patient who has PTS, you can go on to strain print and see what other patients who have PTS are using successfully. And again, as Josh and I have both said, and Marc has said, every patient's different. So, don't take that as gospel, but it could certainly give you a better starting point, or at least seeing what negative or positive side effects they were seeing from a particular product. And the other benefit, particularly for AltMed in the initial and for patients in the long term, is we get access to that data. So our R&D team is constantly looking at the data that's coming in from strain print so that we can develop products that better fit the needs of patients based on the feedback that we're getting from this app. And so we've gotten amazing feedback since we launched it in April. I believe we're up to just under 2,000 patients are logging medication sessions, and we're at 8,500 sessions recorded. So we are aggregating this really large data set of what's working and what's not working for different conditions and different symptoms that I'm really excited about.
Now it's a free mobile app, right? For journaling.
It's completely free. Yep, you can download it from the Google Play Store or the Apple Store. And all we ask is that you use the MÜV FL activation code when you download the app, and that's what gives us access to that data so that we can better develop a product that works for you.
Cool, thank you. And of course, your patient care team, that's important.
Yeah, so education is something that we're very passionate about and focused on. As Marc said, the first time coming to dispensary, it was really overwhelming. Me as a millennial, the first time I went to a dispensary, I was overwhelmed. My eyes didn't even know where to look. It was just overwhelmed. And so we recognize it can be very intimidating and a daunting experience. And so at the store level, we're always going to be there to provide education and walk you through and answer your questions. But we really also have an amazing patient care team available both online via live chat and over the phone. They are trained the exact same way as the med tenders in store. And we have 2 dedicated phone reps and 1 dedicated chat rep for every single dispensary. So I think our average wait time right now is 25 seconds. So there's always going to be someone that's going to be available to talk to you about any questions you possibly have.
And I think being able to talk to a professional is important. I know a lot of people ask me why I work with MMTC, and I tell you it's very simple. Yes, they do have 25 dispensaries throughout the state, but they have an online call center. If you get your medical cannabis card from MMTC, you can call the call center and bring the doctor into this. And especially when you're working with the dispensaries, in many cases the dispensaries can't give out medical advice, but by using that call center, you can now get the dispensary, your doctor, and yourself involved in being able to work out the right dosing for you and looking at the right products. That's really, really critical. You know, I think that's something that's important, is getting your dosing right is the magic to making this whole thing happen. And of course you have a frequent flyer program.
Yep. We do offer a rewards program. You know, we recognize that cannabis is all out of pocket expense. You know, unfortunately it's not at all covered by insurance. The only, positive spin I'll put on that is there's no sales tax. The state does not collect any tax on cannabis, so there is no tax that you have to pay. And we certainly encourage every patient to download and sign up for our rewards program so that you can earn discounts over time. And we do run a lot of discounts. We run a number of promotions on a pretty ongoing basis. We certainly want to make sure this product is affordable and attainable for patients. We do offer a veterans discount. We do offer 20% off for all veterans. We have a 25% pediatric discount. We have a 10% senior discount, which starts at 55. And then we do run senior spotlights from time to time where we give an extra 10% off for seniors. So we assure you we are doing everything we can to make this medication affordable.
And you have a program where you can sign up for a text message to let you know.
Correct.
I really look forward to getting those. So, cool. Well, listen, you mentioned some of the senior specials and things. This will be included in the presentation notes that are out there. You mentioned the senior spotlights. I think those are pretty cool. I'm a senior, so I'm kind of plugging your program. I think that's very
cool. We got another one coming up this Sunday. Don't tell too many people. But yeah, we do have a senior spotlight coming up this Sunday that every senior, everybody over 55 over will get that 20% discount.
Fantastic. And of course, express orders and and pickups, right?
Yeah, absolutely. Once you've kind of dialed in your medication regimen and you found what you're working, I highly encourage patients to take advantage of express order. It's kind of like Amazon. You place your order online, come in. Lots of our dispensaries have dedicated express windows. You're not going to have to wait in line, particularly with COVID. No one wants to be staying in a small indoor space for any longer than they need to. And we'll get you in and out as soon as you can. You can order everything over online. Over 50% of our orders today come through online. That was definitely a huge uptake due to COVID. So thank you to the patients to adapting to this new time that we live in. But you don't have to order online. You can order over the phone. And then we do offer home delivery as well.
Great. Super. Well, listen, we have covered a lot of subjects. I'm going to conclude this webinar. We've answered, I think, almost every question that's out there. But by the way, we did this through the webinar. Thank you very much, Josh and Zack. Thank you. I think we talk about having this being something that can help you. I think you also have to pay attention to your body. Pay attention to having a self-discipline. Your basic care. Watch your diet. As Zack mentioned, your some of the fats and things that are there are important. But also just being able to take care of your body is really important, especially in this time. Zack, Joshua, any parting thoughts?
No, I think that's it, Mark. Thanks so much, Zack. Pleasure to you. I mean, it's awesome. And thanks to everybody who tuned in just to learn a little bit more. And if nothing else, hey, guys, talk to your people, talk to the Veterans Administration, talk to your physicians, talk to your friends. If you're having an issue, just talk, please.
Ask questions, speak up. We're here for you. There's a huge, veterans organization out there who's gone through what you have and is here to support you. And, everybody at the MÜV dispensary is going to do the same. And
at the MÜV dispensaries, you've seen a lot of patients. You've seen a lot of, you have experience with this.
Yeah. And
a lot of people are just
100,000, probably unique individuals. I mean, I'm kind of pulling a number out of the air, but we've seen a lot of people. We've seen a lot of people.
Tap into the scar tissue that's out there. Seriously, don't try to go it alone. This is something when you have a lifestyle medical condition, you know, be humble, ask for help. I know, you know, I was an athlete guy, you know, played competitive professional sports and all this stuff. To be able to just sometimes listen to your coaches was the key to the success of making it or not making it. Let's put it that way.
That's right.
So anyway, well, Zach and Joshua, I want to thank you for your contribution and for joining us. More importantly, for all of you that are tuned in and still tuned into the webinar, thank you very much. We really appreciate it. You'll be getting a follow-up email with the presentation, YouTube video, all the reference material, and you'll be hearing from Zack as well. So thank you, and everybody have a great evening. Appreciate it.
Thank y'all so much.
Thanks, guys. Appreciate it.